English is a tricky language, and many of us use English words in between our mother tongue, especially when a patient comes with a complaint. And if he uses an English word, then we should really probe and get a good history to know what he really means by his complaint. Simple. The opposite of sufficient is insufficient, but the opposite of flammable is not inflammable. So both are same. Well, it's okay with this, but sleeplessness means no sleep. Can we apply this to breathlessness? If sleeplessness means no sleep, then breathlessness should mean no breath. And there is a word, less sleep. There is nothing like less breath. But why I talk about this word? I am Dr. BALA'S, and today we will talk something about the term breathlessness. This COVID situation, breathlessness, the word, it plays a very big role. Many times, both the doctors and patients use this word very loosely without knowing what we doctors actually mean by this word. So it really needs a good history taking and probing what the patient actually means by breathlessness. Patient, it just means a difficulty in breathing. But for the doctor, it is not as simple as that. Now let us see how many terms are there or how they are confusing and what is the actual meaning, how to interpret these words. We will explore that. And finally, I'll tell what is really breathlessness, how to know or confirm it is really breathlessness, and it is better we know the term so that we will not get panic, and also the doctor will not get confused and he should not panic that you have a real breathlessness. Different terms we use just to mean that we have difficulty in breathing. Breathlessness, number one. Second, shortness of breath, labored breathing, air hunger, shallow breathing, difficulty in breathing, dyspnea, asthma, chronic obstructive lung disease, and finally, sigh, S-I-G-H, sigh. Are they all same? Can we explore word by word, term by term here? The doctor hears this word, restlessness, breathlessness. Immediately, we rush for the pulse oximeter. Now the patient becomes more tensed. Why pulse oximeter and all? And the fear factor comes for the patient. This increases the discomfort and difficulty in breathing until you get the device. Oh, I got it. You do not really know what it really means because this is a new experience. Simply doctors ask, do you have any breathing problem? Immediately the person says yes or no, without knowing what actually the doctor means. This is not just a simple word. If you say I have, then we see the oxygen saturation. If normal, okay, there's no problem, the saturation is good. But before that, you should check the device whether it is working properly. But when the patient says breathlessness, and if the oxygen saturation is okay, normal, then what actually the patient means by this complaint? This is a problem. Now, the doctor should take a deep history. Well, shortness of breath. What do you mean by this? How a breathing can be short? If so, what is the length of breath? It looks logic, isn't it? When I say shortness of breath, then the breath should have a measurement, a length. But it has got its own meaning. It means the duration taken for inhaling the air and exhaling the air is short. So you are breathing very fast. The frequency of breathing increases, and naturally, the time taken for one cycle, breathing in and out, is less. Now, actually, what really happens? The respiratory rate increases. This is what shortness of breathing means. Next is labored breathing. Breathing is not a labor. We don't do it as a work. Breathing is not a work for us. It's an involuntary act, as I said. It occurs of its own and its own rhythm. When you feel you need to breathe to get air, and when you try to breathe, it becomes a work. That means as if you are breathing against some resistance, and you have to use some extra muscles to relax and contract the thoracic cavity and the lungs. So labor is a work. When you do work, energy is spent, calories are burnt. Breathing does not consume energy. From birth, you are breathing. You do not become tired. So breathing is not a work, but if breathing becomes a work, it is equal to a labor. That is why we call it labored breathing. Means an involuntary process now needs a voluntary effort. So now energy is spent and you become tired, exhausted after labored breathing. Driving a car is different from pushing a car manually. Driving is equal to natural breathing. Pushing a car manually is labored breathing. So this is about labored breathing. Air hunger. When do you feel hungry? When your blood sugar level goes below a level, all your organs are deprived of glucose, which is the immediate source of energy. Now you feel hungry, giddy, tired, and even confusion. Now you eat and bring back the blood sugar level to normal. That is food hunger. So hungry or hunger is a feeling and food is the remedy. Air hunger means you need air. The quantity or quality of air you are taking in and out is not sufficient. So it is a hungry. It is a hunger. The normal act of breathing either does not give our body enough quantity of air. That means when quantity is less, the amount of oxygen you are taking in also is reduced. In food, glucose is a part, but immediate source of energy. If air is equal to food, then oxygen is equal to glucose. So you need more air means you need more oxygen, that is air hunger. The next term we use, shallow breathing. Shallow is related to depth. Here it is related to the time spent to take the air in and out. When you take air in, which is called inhalation or inspiration, few seconds are spent to take air in. And the next few seconds, you let the air out. This is a depth actually. If the time spent for both these actions are less, you are doing it more frequently, increasing the rate. Why more frequent? Because it is very shallow. To compensate this, you start breathing fast. Sometimes, even normally, you may require more air. At that time also you will have a shallow breathing, but the rate will be more. That means fast breathing. A very good example is after an exercise. You need more air, more oxygen, so naturally you have to have frequent respiration, frequent cycles. So naturally when the act becomes frequent, it becomes a shallow breathing. Difficulty in breathing. It's a vague term. Even if you wear a mask, you feel difficulty because you are breathing in and out against a resistance. Is this breathlessness? If you remove mask, the problem is solved. And you are in a poorly ventilated room or a closed cabin, a stuffy atmosphere, you will have this. If you are in a room with smoke, like a kitchen, you'll have this. And if your nose is blocked, you find it difficult to breathe, but you can breathe through your mouth. And if you are wearing a tight cloth, which prevents the expansion and contraction of your thoracic cavity, you may feel difficulty. Some people in high altitude, like some hill stations, when you go up and up, the atmospheric pressure drops, and naturally that atmospheric air, the atmosphere contains less percentage of oxygen. So definitely high altitude, you will get difficulty in breathing. But if there is an obstruction in the airway, even a foreign body, that may cause difficulty in breathing. Sigh. S-I-G-H. What is actually sigh? A long, deep, audible expiration after a deep inspiration. This is the sigh. This act is not continuous but intermittent. In between, they will be all right. Why they do? Because they feel they get a relief after doing this. So that means what? It's a sort of relaxation. It's a sign of mental tiredness, venting out your sadness, stress, or sorrow. After doing this, you feel you are okay, but again, you will tend to do this after some time. For some people, especially stressed people, this act is very common. Unless you probe, you will not get the real thing. There is no real health problem for these people, but it's a sign of tension or sorrow or stress. This happens usually when someone is alone, when the mind is empty, not occupied by work. When they are enjoying a movie, 2 to 3 hours, they won't do this, or they won't get this type of sigh. They won't feel like doing this because the mind is occupied, diverted with all people around. So this is not breathlessness, but many people say, I feel difficulty in breathing or breathlessness, but finally what happens? It is just nothing but a sigh. The next word is dyspnea. Dyspnea is a medical term for difficulty in breathing. It's not a diagnosis, just a symptom. The cause may be anything. For a common man, it is difficulty in breathing. For a medical person, it is dyspnea. The next word is asthma. Asthma is a chronic problem. It's not sudden onset, so the patient knows he is a known asthmatic. Here also, there is difficulty in breathing, but there are some differences. But this breathlessness or this difficulty in breathing, asthmatic difficulty in breathing, is not breathlessness due to COVID. They can easily differentiate that the usual asthmatic attack or is it something different, because in asthmatic people, they find difficulty in exhaling, that is expiration, that is in sending out the air out. Fine. That is because asthma is an obstructive lung disease. But breathlessness due to COVID is not obstructive lung disease, it is a restrictive lung disease. It prevents the lung expand because of the accumulation of fluid, pneumonia, and we will discuss this separately later. All the above are different words, but have different meaning at different context. The above is again can be a normal phenomena, how and when. Example, while doing exercise, while climbing stairs, or even walking on a ramp, during stress, anger, deep thinking, in a crowded place, a closed room, a continuous talk or singing, all this can cause this sort of difficulty or labored breathing, something like that. So what is needed is a good history taking and asking the person to explain his real feeling, Many times we are guided wrongly due to the poor history taking, and no need to rush for all investigations in which we may waste a lot of time. Never treat reports, treat a person. No equipment can replace our brain. All equipment are the result of someone's brain's hard work and thinking. Well, this is I can see some of you sigh. Oh God, we thought this doctor will clarify our doubt. Now I am more confused. Good. If you say that you are confused, now only you have started thinking. Confusion will lead to fact finding and clarification. Yes, I will explain what is really breathlessness or shortness of breath in my next video clip. Till then, take a deep breath, relax. Thank you.